Hello! Today we will be talking about Fragile X syndrome. What is Fragile X syndrome? It is a genetic disorder in which the FMR1, or Fragile X mental retardation 1, on the long arm of the X chromosome shuts down and prevents it from producing the Fragile X mental retardation protein, which is vital for normal brain development. Fragile X syndrome is inherited, and it can also be called Martin-Bell syndrome or Escalante syndrome. Fragile X syndrome was first recognized by Martin-Bell as a form of mental retardation in 1943, aligning behavioral and intellectual characteristics with physical characteristics. In 1969, Herbert Lubbs developed the chromosomal test to check for Fragile X syndrome. Key characteristics. Physical characteristics of Fragile X syndrome can include an elongated face, a large forehead, large ears, a prominent jaw, overly flexible fingers, flat feet, and in males, large testicles. Cognitive characteristics can include a low IQ, attention deficit hyperactivity disorder or ADHD, difficulty learning new skills, and delays in language, sitting, and walking. Social characteristics can include anxiety and fear, which can lead to poor eye contact. Behavioral characteristics include impulsiveness, hyperactivity, hand biting, and sleep problems. Medical characteristics include autism, depression, and seizures, which affect 15% of males and 5% of females that have Fragile X syndrome. More men than women are affected by Fragile X syndrome. 1 in every 4,000 males are diagnosed, while only 1 in every 8,000 females are diagnosed. Almost half of those with Fragile X syndrome also have autism. 80% of males with Fragile X syndrome have an IQ of 75 or less. Some females show no symptoms at all. A diagnosis is given either at birth or prenatally with a DNA blood test called FMR1 DNA test. There is no cure for Fragile X syndrome, but symptoms can be treated as follows. Medications, including melatonin for sleep disorders, antipsychotics for extreme behavior, stimulants for ADHD, and medications for anxiety. Therapies that can help treat symptoms include speech and language therapy, behavioral therapy, and physical therapy. Factors that can affect prevention of Fragile X syndrome include timing of conception. Older fathers are more likely to lead to a baby being born with Fragile X syndrome. Prenatal genetic testing is also available, but with this, the baby is more likely to have the disease. Examples of tests include amniocentesis, bilious sampling, and use of screening machines. What do educators need to know? Well, just like any disorder, each child with Fragile X syndrome is unique. Symptoms can range from subtle to severe and therefore can affect each child differently. Early intervention can help manage some symptoms, including behaviors and developmental delays. I hope you have enjoyed this video. Check out some of these websites to learn more about Fragile X syndrome.